Hey everyone, Dr. Luke Peterson here, physical therapist with a knee replacement therapist. In this episode of the Need to Know Show, we're going to talk about what to expect when it comes to your hospital stay with having a knee replacement surgery. Before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. So let's start at the beginning, the day of your surgery. So most likely, you're going to want to come to the hospital nice and early in the morning, be on time, be early. It's better to be early than to be running late. And you're going to check in and they're going to take you to your pre-op room. And the pre-op room is basically where the nurses meet with you, the surgeon, maybe a couple other people, and get you all set up, get you all ready to go for the surgery itself. And then when it's time for the surgery, they'll take you into the operating room. You'll go through the surgery, have your knee replacement done, and then let's talk about after having the knee replacement, the bulk of your stay in the hospital. Now, of course, I'll have to also put on the caveat that a lot of surgeries nowadays are in an outpatient basis, so for some folks, you might not even be staying in the hospital, but it is still very common for a good proportion of knee replacements to spend at least 1 to maybe 3 nights in the hospital after your surgery. So after you have the surgery itself, you're going to be taken to a recovery room. And this is basically where you have a nurse there, and they're just checking that everything goes okay as you come out of the anesthetic. You start to regain your consciousness. They're going to check your vital signs, your blood pressure, your heart rate, all those good things, your oxygen levels, and just make sure you're coming out of all of that and coming out of the surgical process okay. Once everything looks stable and doing okay, then you're going to transition to your hospital room. And this is the room that you'll be staying in for the remainder of your stay in the hospital, however long that may be. And really, you're going to get put to work right away. So like I said, you're typically there maybe 1 to 3 nights. And it's really a focus on, we're going to get you moving, get you going right away. So you're going to be visited by your physical therapist for sure. They're going to get you up and walking and standing, possibly with a walker or a cane or some sort of assistive device early on after the surgery. They're going to get you going on some exercises that are going to help you prevent the formation of blood clots in your legs, which is very important, but also exercises that are going to start to move that knee, start to bend and straighten and get that range of motion back in the knee nice and early. You know, we're really going against the clock when it comes to a knee replacement surgery, and as soon as we can, we want to start working on that range of motion and prevent the formation of stiffness and tightness of the knee. Now, it's very normal to have quite a significant amount of pain after surgery, especially as the anesthetic and if you had a nerve block, as those things start to wear off, you're going to start feeling more pain. You're probably going to feel some weakness and not really able to do much with that leg, difficulty lifting it, for example, and you're going to have some swelling for sure. And these are all normal, and especially normal in that acute early phase after surgery. Now, big thing in the hospital is going to be pain management, so taking pain medicines. You may have a IV or a pain pump, they call it, and you want to talk to your nurse about, how to use that appropriately and what to do to use that. You'll probably have some icing. You'll probably have some form of compression or intermittent compression to your legs, again, to help prevent blood clots and help manage that swelling a little bit. And we're just basically getting you ready so that you can discharge safely. And for most people, that's discharging safely to your home. For others, that may be going to an inpatient rehab facility for a little while. And what does that mean, being able to discharge safely? Well, one, it's having the therapist instruct you on walking and using an assistive device, a cane or a walker if you're using that, or crutches. It's practicing going up and down the stairs so that you know how to do that safely and effectively. It's knowing how to manage your knee replacement, so pain management, pain medicine, icing, other techniques to manage that pain. We talk about multimodal pain management, so multiple different ways to manage that pain and stay on top of the pain. There's also going to be some other medications that you might get prescribed from your surgeon. Blood thinners is very common, again, trying to prevent and reduce that risk of blood clot after surgery. And you're also going to get referral for your physical therapy once you leave the hospital. So for some people that may be a short stint of home PT or home care, and then for almost everyone it's going to eventually go to outpatient physical therapy as soon as safe and prudent. So that's really the gist of it all. It's not a vacation for sure. It's really getting you in there, taking care of what we need to take care of, making sure you're stable, making sure you're ready to be discharged safely and appropriately, making sure your pain's under control and you have a plan to manage that pain. And then we're doing our best to get you back home where you can continue with your recovery and your rehab after your knee replacement surgery. I hope you found this video helpful and insightful. Please be sure to leave your comments and questions below. Please be sure to hit that like button so you can share this video with others who may benefit and appreciate it. And again, thank you very much for watching.